Maybe you or a loved one's been recently diagnosed with some kind of a syndrome. A few examples might be a fibromyalgia syndrome, a Meniere's syndrome, a migraine syndrome, an abdominal or irritable bowel syndrome. But the question is, what does that word actually mean? So, syndrome. What it actually refers to is a collective of symptoms, such as pain, imbalance, discomfort, or some kind of irregularity with the function of some part of your body. It's a symptom. But syndrome also implies that for those of us who are in the health or the medical realm, that we don't necessarily know what is causing it. See, if you're having something like a heart attack, if you're having bleeding, you can look at that and say, aha, this is exactly what is causing the problem. But when it comes to syndromes, oftentimes when we're looking at things from a medical or a pathological standpoint, the reality is we can't find what's going on. And the reason we oftentimes can't find what's going on is because there are two general categories of conditions that people can experience. The first one is, simply put, pathology. Bleeding, infections, tumors, fractures, physical damage, chemical damage, all of these different kinds of things where you can look clearly say, aha, that is what is causing the symptoms. But on the other hand, are what are called functional conditions or functional disorders. And this is where things are not working necessarily the way that they should be, but without an apparent cause. I'll oftentimes use the example to distinguish between the two. Let's say that you're looking at your computer or your phone that you're looking at this particular video with. And let's say that you've got a crack on the screen and something like water has gotten onto the inside and it's affecting the way that your phone or your computer is working. All right, well, that's the example of pathology. But a functional condition, this would be something more along the lines like a virus that's gotten into the system. You can't necessarily see it, but it's nevertheless affecting the way that your device is working. The same thing goes with the human body. There can be different kinds of issues, functional disorders, that can affect the function of your heart, your abdominal system, your nervous system, your respiratory system, any number of different systems in your body. But then you go have a lot of the traditional kinds of tests, and they're looking for the cancer, the bleeding, the infection. They say, we can't find what's causing this. You're experiencing all the symptoms, but it's not one of these pathological causes. And so we're going to put up our hands and say, we don't know what's causing it. We are therefore needing to diagnose you with a fill-in-the-blank syndrome. So what syndrome actually is it's what's called a garbage can diagnosis, a diagnosis by default. It's when a person is looking at all of the different kinds of potential medical causes, rule out all of those, and you're left then with a series of functional kinds of conditions as far as what could actually be causing it. But oftentimes, as I said, from a medical perspective, the answer is they don't know what's causing it. Now, the reality is a lot of times, great many syndromes that are out there, part of the reason why they can't find what's causing it is because there is no one cause. See, in medicine, oftentimes we would like to believe that you have one cause and it equals one effect. A causes B. C causes D. But the reality in the human body, that is not the way that things work. A can cause B, or it can cause C. And you can have C caused by A or D or E or F. In other words, you can have multiple combinations of different things all contributing towards the problem. And this is why so many syndromes are such an enigma. Why, when you go online and you're trying to find, well, what's the treatment for my fill-in-the-blank syndrome, why you're not finding just one answer. The reality is because there isn't just one answer. There are most likely a combination of things that are all contributing. One thing contributing 30%, something else contributing 30%, something else contributing 30%. And so if you're looking to try to find a solution, it's always good when you can rule out the dangerous, scary pathology. But as hard as it might be, it means then that your search is only just beginning. And it's oftentimes up to you to work with the right kind of health professionals who are not going to let their ego or my ego get in the way, where we can have a look at you and say, okay, well, these are the different things that we can see are going on in your body. These are the possible explanations for why you might have whatever syndrome you have going on. And so even though we're not dealing with broken bones and, fractures, bleeding, cancers, all of that sort of really nasty stuff, we know we have to be looking for something that's affecting the function of your body. And if we can figure out that, or more appropriately, the combinations of the things that are producing those symptoms and causing that syndrome in you, that then ultimately is how we're going to be able to find on an individual basis the way that you are able to get out of it and ultimately, over a period of time, improve, restore your quality of life to the very best of the ability, no matter what the name of the syndrome that we might choose to call it would be. So I hope this clears up just a little bit about what syndrome is, but also what it isn't. It is not something that you have. It's not something that's on the inside of you. It's simply put the name of your symptoms, and we have to then try to figure out what is the most likely underlying cause or causes so that we can get the best kind of solution for you. Hope that you've enjoyed this video. If you do have any particular questions, please feel free to reach out to us. We'd be glad to help in any capacity we can. Thanks for watching.
For more information about upper cervical care, please call us on 3188 9329 or visit us at atlashealth.com.au.